So this week I'd like to talk a little bit about the HIPAA security rule. Okay, so the HIPAA security rule establishes national standards to protect individuals' electronic health information in any healthcare setting, inpatient or outpatient. This info is created and received and used and maintained by a covered entity. Okay, and a covered entity would be, for example, a hospital or a clinic. Would be another example of covered entity. So the security rule requires appropriate administrative, physical, and technical safeguards. Okay, so a lot of people doesn't understand exactly what do those safeguards mean and what do they provide security for. Okay, so we have administrative safeguards. What does that mean? What's that stand for? So administrative safeguards would mean security for the workforce security within a hospital, to make sure everything is safe and secure and that they're patrol around in case anything pops up that they need to take care of. It would be any types of training as well, would be any security and safety trainings would be an administrative safeguard. Any kind of business contracts or agreements would also be a security safeguard, and those are very common to have in healthcare. Any contracts and agreements for patients and for employees. Next, we have physical. So physical safeguards, what does that mean exactly? So an example of physical safeguards would be facility access controls. That's a common physical safeguard. Another one would be the workstation use. Make sure that everything within the workstation is safe for employees and patients, that there are nothing that can harm them and can cause any issues legally to occur. Another one would be any media device or controls. Since technology has become very common in healthcare, any media devices and things like that are often used, so we have to have some physical safeguards for those as well. Next is technical safeguards. So what does that mean? So a technical safeguard example would be within electronic health records having an automatic log off. Many times employees will forget to log off when they log on to an EHR to access patient information. So a lot of times electronic health records will have a time limit to be able to have access to an EHR without being able to, if you're not navigating in it, then it will obviously log you out within probably like 10 minutes. So if you're not, using the EHR and you're not navigating throughout it and doing things within the chart with patient information, then it will automatically log you out. And that's just a good safety feature to have. Another one would be passwords. Having username and passwords is another really important technical safeguard. You also have encryption, and that is very commonly used and very important with prescriptions. And it's also good to have encryption for any type of patient information that can only be accessed by specific individuals within a healthcare facility. So the HIPAA security rule has been phenomenal in the past couple years with healthcare. It's really helped set standards for all our security and privacy issues that we've had in the past. So I'm very thankful that we have that and that it has created a more positive and uplifting and safe environment for patients and for employees. So we'll be talking a lot about that rule this week, and I look forward to hearing your thoughts on the rule and what you think that has been the benefits and the disadvantages possibly with the HIPAA security rule. Okay, if you have any questions, feel free to contact me. Thanks.